Hello, everyone. Today I have a very, very extremely special person in Egypt, in Cairo, with me. It's an honor to be beside him right now in the OR, this very same OR I perform my surgeries at. Professor ستيڤن Wilson, the master of penile implantation of prosthetic urology, who not just taught me, taught all the experts all over the world for the past decades, and
50 years.
50 years. And we call him the Godfather, and it's a title I don't think anyone else could. It took 50 years, as Professor Wilson mentioned, to earn that title. Not only has he taught us, not only does he lead us by example, and I continue to learn. I continue to learn every single time. He's always keen on visiting us, checking on us, seeing what his sons and students are, how they're performing. And I want to mention something that I learned just recent from you, sir, that despite the 50 years of experience and being the leader and the master and teaching us all, you taught me never to be shy, to change your technique, to change your way when you find something innovative and worthy of changing for. And that I learned from your famous talk, The Paradigm Shift. Mm-hmm. It's great to have you, sir.
Thank you.
It's an honor. I can't even express.
Well, this is an operation that's been around 50 years. When I finished my residency in 1973, I went into practice with my father in the middle of the United States, a little state called Arkansas. Only has 2 million people in the whole state. And I wanted to do something different. And so I found out about this prosthesis, both the penile prosthesis and the sphincter, which was developed by a professor at Baylor University in Houston. And I went down and took his second course. And then I came back to Arkansas. I did the first implant in Arkansas. And then by 1990, I was totally focused on it and was doing the most of anybody in the United States. And what I've learned over the years is that you got to constantly be watching the operation and trying to figure out how to make it better, number one, safer, number two, and quicker, number three. Because as with any surgery, the longer the incision is open, the more time the bacteria have to fall into the incision and make a possible infection. And while a normal operation, if it gets infected, we simply open up the incision and wash it out, and it closes itself. But with a device that we implant, you got to take the device out, and then it's a disaster. So I'm always working on the technique to decrease the number of infections and make it so it doesn't break so often.
That's great. And speaking about these characteristics or these rules for the best surgery, may I ask you, sir, what does it take? What does it take to be an expert at this field? I mean, how would I be called an expert? Who do you call an expert?
Well, I think you got to be doing it for many years. You've got to publish a lot of papers on it so that you're studying the science of it.
I remember you always say, if you don't publish, you perish.
Yeah, and you do. Or you become a private practitioner and don't ever learn anything or think out of the box. So you've got to publish and you've got to teach others. And if you do that, then you're what I call an expert.
That's right. And that's a really important highlight, is that teach others. And this is one of the pearls I learned from you, sir, is that teaching. And the more you teach, the more you learn, even as an expert.
Sure. I learn a little something every case. Like the case you did today, I thought that was fairly clever to grasp the urethra in order to keep yourself oriented. And just another little trick that after 50 years and 11,000 operations, I still learned something.
Well, I took my share. I'm glad to hear that. And another thing is that it's a famous question. We still keep getting that from our patients, especially in the Middle East. Inflatable implant versus a semi-rigid. I mean, I'm really satisfied now that because of the awareness we've been starting back for a few years now, patients now really understand why the IPP or the inflatable implant is superior to the malleable implant. But I always like to listen from you, sir.
Well, you know, one doctor might say that one's a Mercedes and the other one is a Fiat. But that's not really true, because the inflatable is truly different from the malleable. The malleable is like having a stick in your penis. And so you can penetrate your sexual partner and you can have an orgasm. But the inflatable, you get girth, which is really important.
Yes.
Because a woman's special spot of sensitivity that brings her to a climax is just inside the vaginal vault, and thrusting really doesn't do much as expansion. So full expansion in the vaginal vault and then thrusting. So the inflatable is probably in this country 5 times more expensive, but it's not like a Fiat and a Mercedes. They both get you to the same destination, one a little more luxuriantly. But the malleable and the inflatable, they get you to the same destination, but you really, really get a much better experience, and so does your partner.
And I think that the sooner the better. I mean, once a patient is indicated for such surgery, the sooner the better. Literature has proven that the more you wait for the surgery, I mean, provided that you're indicated for surgery, that harms you when it comes, speaking about girth, it harms you when it comes to length and girth. Is that right?
If you know, there's an old expression: if you don't use it, you lose it. And that's true with your penis. If it doesn't get erect for years at a time, it gets shorter and thinner. And even though then you get an inflatable implant, it's not as good as it would have been if you'd done it when you first noticed the fact that you couldn't get an erection.
And speaking about patient awareness, we have a good or a decent size or a decent size, let's say size of information out there when it comes to social media. And I myself, I count on social media for raising the awareness. But the problem is I sometimes, maybe recently, I feel that social media could act as a double-edged sword. I mean, as much as it might benefit the patients, they have a lot of information, but at the same time, they have a lot of misinformation. So please, sir, I'd like to know your advice. How would you advise patients who are planning on the verge of surgery and like surfing the net, hearing here and there about techniques, and becoming more hesitant and confused, opposed to being more confident and rushing with the surgery when they need it?
Well, unfortunately, there is no police force on social media. And so the people can say whatever they want to say, and they can describe themselves as an expert when they're truly not. And I think the one thing patients can do is to ask the surgeon how many he does, because this is not your knee. This is your best friend, and you want the surgery done right. And so finding out how many he does. Is he a doctor that focuses on penile prosthesis implantation, or is he an occasional surgeon? And you don't want occasional surgeons operating on your best friend. So that's one way. Volume is everything. The second way is check on his website and see if he's publishing anything. The third way is check on his website and see if he's teaching others his techniques. And so those 3 things truly make an expert. And you can go, some of these guys will say, well, they do 200 implants a year. And then you see what their publications are, and there are no publications. And so you know he didn't do 100 a year. So you just have to sort of be a detective, because unfortunately, as I said, there are no police on the social media.
Right. That's right. And be always involved in the scientific arena, in the scientific world, and exchanging experience and exchanging knowledge, and not just attending the meetings, sharing with the meetings and participating and presenting. I mean, there's always room for improvement and learning, as we just mentioned. So that's your valuable advice to the patients and your valuable advice to us as physicians, maybe the junior physicians that'll be maybe watching, if they want to start their career. Do you have like a guideline for them how to start their career?
Well, unfortunately, penile prosthesis implantation is not generally taught in residency programs. And for example, in the United States, where we do many more than you do here in Egypt, we do about 30,000. You do about 9,000 here. So actually, that's about equal, though, because you have 100 million and we have 370 million. So it's about the same.
And add to that, Cairo is considered one of the, if not the leading hub when it comes to medical tourism within the region. Mm-hmm. So, like, for example, if I were to speak on my behalf, I have like 70 to 80% of my patients come from abroad. From the Gulf area, from Iraq, from Saudi Arabia, from Kuwait, maybe from North Africa, some patients. So, yes, that's right. I don't want to keep you anymore. You're tired. I know you had a long day. You had other surgeries today as well. And we're supposed to be meeting in a while for dinner, inshallah. I'd like to end with one of your most famous sayings that I have engraved is that we must respect the tincture of time. I love that. And I use that all the time with my patients. Tincture of time. Of course, I translate it into Arabic in different forms, but tincture of time really, really does magic with patients.
Yeah. Because lots of times a patient will look at his genitalia after a penile prosthesis and they'll say, I don't like where the pump is, and I don't like the fact that it bends a little bit, and then you say, just wait. It will heal. And the beginner wants to rush right in and fix whatever the patient is unhappy about. But most of the time, if you just sit on the patient for 3 months, the healing process will make everything okay, and you don't have to subject him to another operation just because he thinks something's different.
And I think you might even sometimes cause harm than benefit.
Sure.
If you go in sooner.
Yeah, so tincture time is, it's like being a young bull and an old bull. And it's a parable. Have I told you this one?
No, I'd like to.
Okay, so there's a young bull and an old bull on a hill, and they're looking down there, and there's a bunch of female cattle down below. And the young bull says, let's run down the hill and have sex with one of those girls. And the old bull says, no, son, let's walk down the hill and have sex with several.
Which makes all sense. I speak from the bottom of my heart. This is a huge honor, sir.
Oh, you're welcome.
Honor. And this is not our first time to meet. And I hope we meet again in Cairo soon, please.
And you did a great job on that surgery.
Thank you so much.
Really great job.
Thank you so much. I mean,
Are you still recording?
Yes.
One thing I want to say is this guy, he actually took a fellowship with a young man he's about your age, isn't he?
Yes, almost the same.
When he was a young man, I trained him in Germany, and he became the biggest implanter in Germany, and now he's training others. So this is like, I call Danair Osmanoff, who was his instructor, I call him my son, so this will be my grandson. Thank you.
Thank you, sir. You mind a hug, please? Please.